to be talking about inserting a Foley catheter. This is a Foley catheter tray. It is actually the kit, and so before you open up the kit, you want to make sure that there's no rips, tears, no moisture. You also want to check the expiration date. And this particular expiration date, it would be indicated right here, and it expires 11/30/2021. So once you have checked that the integrity of the package is okay to use, you can basically open it up through this white tab by peeling this white tab. Okay, this becomes trash. Now you're ready to open up your kit. This can become your trash bag when you are disposing of the items that you no longer need for your kit. One recommendation I have is to make sure that you've got it such that it will not fold over into your sterile field. So I'm going to put it here at the end of the bed. This basically is trash, so I'm going to put this over here because we don't need it anymore. Since I have a sensitivity to certain gloves, I'm going to be using the Protexis gloves, which are latex free and powder free, but there are gloves in the catheter kit. So in order to open up the catheter kit, you want to take the furthest flap that is away from you. You want to open up that first. Then you're going to open up whatever flap is next. Typically it's the right or left. You may touch the outer 1-inch border of all of these edges and not contaminate your sterile field. Okay, once your kit is open, you need to remember that this is a sterile field. So in order to keep my field sterile, I'm just going to turn my kit around so that I'm not fighting with contaminating my field. The next thing we have in here is we have the drape that will be going underneath the patient. You want to make sure that you maintain the 1-inch border around and that you put the shiny side down. Typically the pockets are going downwards to understand the shiny side down. So I'm going to lay this in between my patient's legs. The patient is in a dorsal recumbent position, and I'm just going to lift her up very slightly on both sides so that I don't contaminate this sterile field. This right here is an extension of your sterile field. So once that's intact, I'm ready to proceed. Again, these are the gloves that are in the kit. I'm not going to be using those. You want to make sure you do not turn your back at all on your sterile field at any given time. And just like we talked in our very first lab on how to open up the gloves, you're going to follow the same concept here. You will be putting your non-dominant or your dominant hand on first, followed by your non-dominant hand. And if you're having trouble, you can hold the 1-inch border around the edge of the paper. And now I'm putting my gloves on, and of course I can straighten whatever needs to be straightened. Okay. Just getting that cuff down. Okay, this right here is the fenestrated drape. We do not use this. Some of the ATI or Mosby videos will show using the fenestrated drape. In my opinion, as a professional, it just kind of gets in the way, so I'm just going to put that there. Now in the kit, you have several things in here. You have your betadine, which we will not actually be using on our patients. We have our sterile lube. You have the cotton balls here, the tweezers here. This cup right here is to collect a urine specimen if it's been ordered. And then this is your sterile saline. Underneath here, you have your catheter as well as your bag. This right here would be your sampling port. And this right here, the orange hub, is actually going to be where you're going to connect your sterile saline. When you are taking this piece of blue paper off, you have to be really careful that you don't contaminate the catheter that's inside. There's several different techniques that we will show you during the actual catheter skill lab, but in the meantime, I'm going to show you the way I do my unveiling of the catheter. Okay, now that that is unwrapped, I'm going to go ahead and attach the sterile saline to the orange hub. The reason why you want to do that is when you are ready to insert the Foley catheter, once you touch the labia, this left hand or your non-dominant hand becomes dirty. And so trying to get the sterile saline attached to the catheter with one hand can often be difficult. The next thing I'm going to do is I'm going to put the catheter itself inside the water-soluble lubricant. This is just a trick that we use, especially as OR nurses. We want to try to keep everything as intact as we possibly can and to maintain sterility throughout the entire procedure. So by putting the catheter itself into the lubricant keeps everything very compact. Next thing I'm going to do is put my tray back on here. Then I'm going to take my lube, pour it off, and I will be squirting this onto the cotton balls. Okay, one thing that you can do before you squirt the lube or squirt the betadine is you can separate the cotton balls just to prevent the cotton balls dragging over your sterile field. Once this is done, I am then going to use the scoop method to take it over to the patient. Some of the videos will show you that you watch will show you preparing the Foley catheter kit between the legs. Some of the videos will show you some other techniques that we do not follow in this particular course. The method in which I'm showing you in this particular scenario is the way that we expect you to abide by the Foley catheter insertion. So keep in mind, try to remember the concept of elbows up. And the reason being is your elbows can sometimes cause your arms to go in a 45-degree angle. By keeping your elbows up, it keeps those arms from dropping down into your sterile field. Okay, so I've got my kit ready to go. Okay, I've got my kit ready to go. I've got my betadine ready to go. Next thing I'm going to do is clean the labia with my betadine. Once my hand touches the labia, it is now considered dirty. So I'm going to go on the outside, down, go around, and drop my cotton ball. I'm going to go on the outer side, go down, around, and drop my cotton ball. The reason why I'm going around is if I take my cotton ball and go across the field like this, once it's been cleaned, it violates the sterile field. Next, I'm going to go down the middle, go around and drop my cotton ball, and I can drop my syringe while I'm at it. The next thing I want to do is get access to my catheter. Now keep in mind we've already got it lubed. So I'm going to take it out of the lube and I'm ready to insert. You want to ask your patient to bear down as if they're urinating. And you're going to insert the catheter until you see urine and then about another 2 inches after that. The reason being is we want to make sure that we are in the bladder when we do that. Once I see the urine, I can then inflate my sterile saline. And I prefer the one-handed method. Once my sterile saline is hooked up, I then can pull back and I know my catheter is in place. Now I've got some dirty hands. I will change my gloves. And I will put on non-sterile gloves to finish my cleaning up process. And the reason why you want to change your gloves is your hands are covered with betadine and patient fungus or debris, any type of blood residue, etc. And you don't want to spread that throughout across the entire patient. So now I can take my bag out. I can affix the catheter to the inside of my patient's leg. They do have devices called stay locks where this device will actually hold the catheter in place. You want to make sure that you hang the Foley catheter on the bed itself. Do not put it on the bed rail. And then you want to attach this to the side of the bed or onto the linens. Now I can just clean up my Foley catheter kit. I can ask my patient how well they are doing, and we have got a Foley inserted into our patient. Hello. So if you recall, about 3 days ago, we inserted a Foley catheter into our patient. Well, the doctor has now since ordered that Foley catheter to be removed. Keep in mind that anytime we do any type of procedure with our patient, we do need a doctor's statement or a doctor's request to be able to proceed with that particular skill. So in this case, he's ordered the Foley to be removed, and so we need to remember that we have all of our supplies, which is going to be a syringe as well as a waterproof pad. And the reason being is we don't have to have sterile gloves for this procedure because it is a clean procedure. We need to make sure that we utilize our AIDIT principles. And remember, AIDIT is a knowledge, identify, tell the patient what exactly you're going to be doing, the duration that it's going to take, and remember to say thank you. The AIDIT principles need to be applied to everything that we do when we do a patient encounter. So what I'm going to do next is I am going to perform my hand hygiene as I go into my patient's room, and I will be identifying myself as well as the patient. Hello, how are you today?
I'm good.
My name is Tina Mathers, and I'm actually going to be your nurse today. Your physician has ordered the removal of that Foley catheter, which I'm sure you're going to be very happy to get rid of. This procedure should take about 5 minutes. Can I get your name and date of birth, please?
Yes, my name is Ann Smith, and I was born July 31st, 1962.
Okay. Is there any drug allergies that I need to be made aware of before I proceed with this procedure?
No, I don't have any allergies.
Okay, so what I'm going to do is I'm going to pull the sheets up from the patient's feet. And the reason why you want to do that is A, it keeps the patient warm, B, it maintains their modesty, okay? And that's real important. Put yourself in the patient's shoes. You wouldn't want to have the sheets all taken off and you're exposed to everyone known to mankind. So I'm going to roll the sheets up from the feet of the patient. And rolling is a lot better than pushing them up because later on, it just is easier to get those sheets back down where they need to be. Next, I'm going to roll the gown up. I'm going to check for any redness, etc. within the patient. Right now, I do not see any redness. This, like I said, this is a clean procedure, so all I'm going to require is just gloves on. Okay. Next, I'm going to take my waterproof pad. I'm going to put this in between the patient's legs. You don't have to be as careful with this pad application as you did when the procedure was sterile, only because, again, this is not a sterile procedure. Okay? So I'm going to check once again. It looks like everything is fine. I don't see any redness, any itching, any irritation. I'm going to disconnect from the thigh first, then from the bed. Okay? Next, I'm going to grab my saline syringe. I'm going to place the syringe in this orange hub right here. You want to make sure that you draw the same amount of fluid out that the nurse documented before you as far as being in the balloon. Okay, so I've got my fluid taken out. The next thing I'm going to do is ask the patient to just exhale as I'm taking the Foley out. Now, there's different procedures that you can do. I like to do the wraparound method around my finger. And the reason being is when this Foley eventually comes out, it's going to sling urine everywhere. You also want to check to make sure the catheter is intact, there's no rips or tears, as well as you want to document the amount of fluid that is actually in the urine bag. So here you're going to document the date and time, you're going to document the amount of urine, what the urine looks like. Okay, this will all go into your EMR. This bag in and of itself is trash, and then you can clean up after your procedure and get the drapes back down onto the patient. Okay, Mrs. Smith, do you have any questions for me today?
No, I'm very comfortable.
Was that procedure okay for you?
It was fine.
Okay,
Very quick.
well, you can, if you need to get up and urinate, please use your call bell button first so that I can come in and assist you. And once we can determine that you're able to get up and freely move without any falls, you'll be able to urinate on your own. Thank you so much for allowing me to assist you today.
Thank you.